Very good. So there's multiple benefits of being outdoors. You've mentioned the melatonin production in cells, which reduces the reactive oxygen species and the inflammation. Do you think that removal of glucose in the blood could be part of the story for how it benefits our health?
Yeah,
Particularly as
yeah,
my
that's an excellent
fibroblasts are very
question.
energy hungry.
That's an excellent question. So this is relatively new research that has been done. Again, Robert Fosbury sent me an article. I don't know if it's in a preprint. I don't know if it's been published as yet, where he took some volunteers and basically subjected them to a glucose tolerance test. And what he found was that those that had not infrared light, but red light, this is around 670 nanometers, so it was in the visible spectrum, but he put blinders on them so they couldn't see, and he did about an 80 square centimeter area on the back of the back, and he exposed some of them at random to this red light, and others he did not. And what he found was that, amazingly, those people who had the red light had less of a spike in the glucose, statistically significantly less than those that did not have the light. Okay. What that tells me is that we should be eating when the sun is up. We should be outside eating if we can be, because there's something that switches on with light that allows our body to metabolize better than if we didn't. Now, so here's the question is, why was the glucose lower in those that were having the red light? So they did something else in the study to confirm their suspicions. Their suspicion was, this was their hypothesis. Their hypothesis was, now remember at the beginning we said that these protons build up behind a dam, and then they come down the dam and they turn the turbines, and then the turbines make ATP, right? What their theory is that the red light in this case at 670 nanometers actually is causing the water molecules around the pump to become less dense, less viscous. And because of that, the pump is able to turn faster. And because it's being able to turn faster, the whole system is able to metabolize sugar more efficiently and bring down glucose concentrations. Now, that was their hypothesis. How did they prove their hypothesis? Well, as anyone knows from metabolism, the end product of glucose metabolism is what? Carbon dioxide. And so they were able to measure carbon dioxide levels coming out of these subjects during the study by measuring it. And sure enough, what did they find? That those that had the lights on them had higher, statistically significantly higher levels of carbon dioxide than those that did not. So basically glucose goes to CO2. And what they found was that glucose went down and carbon dioxide went up. And so at least one of the ways that glucose went down was that it was being shuttled through glycolysis, the Krebs cycle, the electron transport chain, and making ATP. So what does that mean for us? That means that getting red light, these sorts of things, can actually help with reducing glucose, improving metabolic health, and reducing oxidative stress. And remember, this is just 670 nanometers. This is the thing that I love about this is people, when they hear this kind of information, they're like, okay, I need to get a near infrared lamp. I need to get a red lamp. What's the right wavelength that I need to get? And it's like, you know what? I got good news for you. The sun emits all of the wavelengths. So you don't have to worry about that. If you just get outside, you are going to get all of the wavelengths that your body needs to get. Why put it to chance and buy a machine that's going to give you just a specific wavelength that you might need the one right next to it? You know, that's my concern. And so what I've come to the conclusion of is that, look, the sun is something that's free. It happens every day. Yes, there are places on this planet where it is seasonal, and there are things that we need to do to sort of get around that. But I don't think that the rate limiting step for us getting the sun is where we live on the planet, as much as it is changing our behavior and getting outside.
Okay, very interesting. Yeah. So there's a whole lot of benefits. There's the nitric oxide you mentioned that can help dilate the blood vessels and overcome the hypoxia, which is unfortunately happens as a result of surgery and the inflammation that causes the damage to the blood vessels. And we know
Yes.
that hypoxia is a major driver of fibrosis along with the inflammation. There's the reduction in the glucose, which can help potentially to starve the myofibroblasts that are very energy hungry because they switch their mode of metabolism. And I guess potentially there could also be a lift in mood from being outdoors, which could
Yeah.
help reduce inflammation as well.
Well, yeah, and if I'll tell you, there are so many other benefits. You know, doing it this way doesn't give you side effects, it gives you additional benefits. So being outside improves ventilation, and ventilation is very key in terms of getting rid of toxins in your body, carbon dioxide. There's also pretty good evidence that being outside near green trees not only is good for getting reflective infrared light like we talked about before, but there's actually chemicals in the trees themselves that are given off that have been shown to boost our immune system. You're in Australia, and I probably don't have to tell you this, but during the after the First World War, around the time that we had the pandemic, my understanding and reading is that Australia almost lost all of its eucalyptus trees because the world was in high demand for eucalyptus oil, which is very well known to improve innate immune systems. There's actually a recent paper that actually showed this. And so you have an abundance of that type of tree down there. I hope still in Australia. Yeah, so the eucalyptus is a very powerful oil that has been shown to dramatically improve the phagocytotic ability of the innate immune system. And so, of course, these trees give off these what they call phytocides, and they can actually improve the innate immune system. There was a study that was done a number of years ago in Japan where they took CEOs that were in their office buildings in Tokyo, and they took them up into the Hinoki cypress forests, and they exposed them, and they walked, and they did a number of measurements, and basically what they found was that the phytocides from the Hinoki cypress trees, and this is not specific to Hinoki cypress, this can happen in a number of different trees, that actually improved the cells, the ability to phagocytose, and the granules in those cells. Now, when they took them back to the hotel in Tokyo and they exposed them to the essential oil of the Hinoki cypress, they noticed many of the same properties that they found when they took them out into the forest. But there was one difference that they did not see in the hotel room that they saw when they actually got them out on hikes and out into the forest. And that was urinary cortisol levels were lower in the forest, which shows that they were under less stress than there was in the hotel room. It was higher in the hotel room. So what does this tell us is that you're not only getting the benefit of these chemicals that you are walking outside in and getting the sunlight, the near infrared, and all this, it's a package deal, but you're also, away from work. You're out in nature. We don't associate stress and work with walking in the trees and in nature. So there is a gestalt to it where the effect is greater than the sum of the parts.
For sure. The eucalyptus oil sounds like an excellent topic for another IAA blog. I think I can see that coming up.
Yeah.
So I'm curious about whether the heating of the tissues that can occur when you're sunbathing, for example, or potentially with near-infrared therapy. Do you think that could be a problem?
I don't think so. There's another completely different type of therapy called hydrotherapy, where we're purposefully submerging or applying hot compresses to patients that are very hot, with the express purpose of raising the core body temperature up to 102, 103 degrees. This is actually a technique that's been around for a long period of time. It actually has pretty well proven medicinal purposes. In fact, this is exactly was the basis for the Nobel Prize in Medicine in 1927 that was awarded to Dr. Wagner Joreg who was a Austrian psychiatrist, who noticed that when he heated people up with neurosyphilis, he noticed that their neurosyphilis basically was cured. And he did this using malaria. So he'd take patients with malaria, take their blood and give it to his patients, basically giving them malaria. And the high fevers that they would get from malaria would cure neurosyphilis because the fever stimulated the body to amp up its immune system and take care of the invader. So the amount of heat that would be raised in the sun from near infrared radiation, I think, is pretty negligible. I would say, however, that it's very possible that you could have heat stroke. So you have to stay well hydrated and make sure you don't become dehydrated. That is a very serious thing that could actually happen pretty often. In our area of the world, in Southern California, we have the Grand Canyon, which is in Arizona, not too far away, and you would be surprised how many people per year get severely injured or die just walking down Grand Canyon trails and not realizing how hot it is and get dehydrated and get heat stroke. I'm sure you have the same thing there. I've seen pictures of Australia where you have very similar looking areas, and I'm sure the same thing happens. It's very, very hot. So yeah.
For sure, yeah. So that's kind of a nice lead into my next question, which has been on my mind quite a bit recently. There's some research out there that shows that near-infrared radiation actually increases inflammation in the short term and also increases the activation of the key pro-fibrotic cytokine TGF-beta1. So how do you reconcile the apparent pro-inflammatory effects with the outcome in the end that it's actually anti-inflammatory and anti-fibrotic?
Yeah, no, it's a good question, and it has to do with timing. It has to do with if the appropriate response to an invader or an injury is to have a good amount of inflammation to take care of the issue and then for it to turn off. That's the appropriate. And so there's a time for high levels and there's a time for low levels. To give you an example as well, with hydrotherapy, we know that when you increase the body temperature to 102 or about 39 degrees Celsius, that there is a tenfold increase in interferon. Now, interferon is that very specific cytokine in your body that makes you feel like you have the flu, but it's also the cytokine that gets rid of the virus and eliminates the virus. And if you don't have that sudden burst at the beginning, what you then develop is a chronic infection that doesn't go away. I'll give you another example. Hepatitis C is an example of a chronic viral infection. And the problem there is that the body did not eliminate that virus in the beginning, and the virus is still able to go on and to cause inflammation. This is the same sort of stuff that happens in the liver. You get liver cirrhosis. So what's the treatment for hepatitis C? It's actually pegylated interferon, which means high doses of interferon that's able to be given over a long period of time and keep it elevated. And so we can actually today cure a chronic viral infection such as hepatitis C by giving high amounts of interferon. So why would it be that giving something that is pro-inflammatory gets rid of inflammation? It's the same sort of situation with sunlight. So sunlight is able to amp up the immune system to deal with the issue so that when it's dealt with, it goes away and there's no reason to continue to activate that immune system.
So it's like a hormetic response. A small dose of something can actually help in the long run.
Yeah, especially if it's helping the immune system get rid of the inciting cause for good, so that it doesn't continue to excite that low-grade inflammation.
Very interesting. So, do you think that the apparent benefits of short-term and we should say constrained increases in inflammation and activated TGF-beta are kind of specific to being outdoors in the sun? Because there are other treatments that can potentially do this, but I'm wondering, are they advisable or not? We know that, outdoor situations seem to be helpful.
I think that outdoor situations seem to be helpful. The issue that I have with a lot of these other treatments, I'm all for researching this and trying to get down to the nitty gritty. But what I often find is that when we try to isolate the particular mechanism and then try to imitate that, we sometimes lose, again, the gestalt of the whole thing. So in other words,
Mm.
gestalt means that the effect is greater than the sum of its parts. I'll give you an example of this where this has happened in history. We noted in people with lung cancer that those that had diets high in vitamin E and vitamin A did very well and actually had better survival rates than those that did not. And so, of course, the foods that are high in vitamin A and vitamin E are generally fruits and vegetables. Okay, so what scientists did was they then said, oh, maybe there's something about vitamin A and vitamin E which is beneficial in lung cancer. Let's do this. Let's go ahead and extract it. Let's isolate it. Let's purify it. And let's give it at high doses to people in a randomized controlled trial to see if that will help survival in lung cancer patients. And how many times has that logic been repeated over and over and over again? Like the same thing. What's the wavelength that maybe helps one particular cytokine to be higher or lower or whatever it is, and try to reproduce that by making a machine that then transmits at that particular wavelength. Well, as it turns out, when they did this trial, they actually found that those that were supplemented with higher amounts of vitamin A and vitamin E did worse than those that were not supplemented. And so the question, obviously, that is begged at that point is, was there something in the environment of the vitamin A and E? Was it sitting next to some other complex? Was it associated with something else that, when taken in that form, was having a different effect than when it was taken in isolation to itself? And so I can't help but think that the light coming from the sun is very complex. It's very complex because it's a broad spectrum of light. It's happening in a very specific way. It's happening at a very specific intensity. And if we are going to try to figure out which wavelengths do what, that, and the other, it's very possible that we could get that messed up, just like we've done, I believe, with LED lights and the fact that we've got visible only light, but we've eliminated, without even thinking about the health consequences of all of the other light that we would normally be getting at the same time in the other part of the spectrum.
I absolutely agree. The body is so complex; it has so many feedback effects and other effects that we're still figuring out, that you mess with one little tiny part and it can have completely different effects to what you expect. For example, blocking the signaling of TGF-beta actually increases the effects of TGF-beta by ramping up other pathways that it signals through. So,
and that's the difference between that's the thing that's really important for people to understand when they look at studies, and they will see that there is some effect that happened in a petri dish. The body is not a petri dish. The body is far more complicated than a petri dish. I can tell you, just as being a physician, I may have a patient, like if I have a patient with an infection, let's say they have a urinary tract infection, and I take a sample of their urine, which has the bacteria in it, and I put it on a petri dish, and I can see the bacteria now growing on this petri dish. And then I put down little antibiotic discs on those culture cells to see which one will have a area that is not growing. And then I will figure out, I now know which antibiotic that the bacteria is not going to grow under. It's one thing to say that the bacteria are going to be killed by a specific antibiotic. It's a completely another thing to be able to say with any certainty that if I give this antibiotic to this patient, that they are going to definitely get better, because there are so many other factors that go into that. Is the patient allergic to the medication that I'm going to give? Is it the right dose? Is it the right timing? Is the patient so far gone they're now into septic shock? Have they gone into organ failure? All of these things are mitigating factors that cannot be accounted for on a small petri dish. So yeah, you're absolutely right. It's more complicated.
For sure. So, given what we've just been saying, would you recommend that people who like they might be in the winter in the northern latitudes, or they're shift workers, would you recommend that they take vitamin D and melatonin?
Yeah, so I take vitamin D myself, and I think it's a good idea to do. I just think that the society that we live in and the culture and the just how we live, we're not going to get enough sunlight to get enough vitamin D. So I think it's a reasonable thing to do. We measure here in the United States in nanograms per millimole, I believe, nanograms per millimole or milliliter, I should say. And for those units, I would recommend being around 50. I mean, the normal recommendation is around 20 to 30. I think for bone health, 20 to 30 is reasonable, but if you want the extra benefits, I would push it up closer to 50. And I can't remember what that is in the units that you might be using there in Australia, but you can do the conversion. I think it's 2.5 difference. So that's vitamin D. Now, melatonin is a different topic. I remember that melatonin is a sleep signaling molecule when it is taken orally. So you're taking melatonin and you're ingesting it, and it's dissolving in your stomach and going into your blood. And that is going to tell your body that it's time to go to sleep. The type of melatonin that you need, though, is the type of melatonin that is stimulated by near-infrared radiation directly in your mitochondria. That type of melatonin is not going to be supplemented by you taking a pill of melatonin, okay? The only thing that pill of melatonin will do is sort of help you at night when you're sleeping, taking care of the mitochondria. It's not going to take care of the stuff that we're talking about during the day. And I would not recommend taking melatonin during the day. It's going to be very confusing for your circadian rhythm. So don't do that. The other issue that we have here in the United States that you may not have, and maybe you can inform me, that melatonin here in the United States is not considered a drug, and it is therefore not regulated by the FDA, and it's basically a supplement that you can buy over the counter. Now that may sound good, but the problem is that it's not regulated either. And so there could be brands out there, for instance, that may just have cardboard and sugar as opposed to melatonin. So you have to make sure that the supplement is like investigated by a third party, that is validated that this in fact includes melatonin. Now, if that's the way it is in Australia, and I'm not sure how it is, if it's a prescription, then you can feel assured that that's what you're getting. If it's a supplement, then you have to make sure that you're getting it from a reputable source.
It has recently changed in Australia, so it was prescription only, but now we can buy it over the counter. I personally refer to Consumer Lab, who do independent testing of all the supplements. So I use their testing results guide me in what I buy. Yeah.
Excellent. Yeah, the one thing I would say about melatonin is if you are going to take melatonin at night, I would start off with a fairly small dose, usually around 3 milligrams. And if you decide to go up, realize that as you go up, the effect of melatonin becomes less. It's actually very paradoxical, and it can actually work against you as you go up higher and higher in doses.
Another counterintuitive effect of the feedback effects in the body. Yeah.
It is very beneficial, by the way. I would say it is very beneficial for jet lag. And there's a very specific prescribed way to take melatonin depending on which direction you're traveling in. If you're traveling to the east, it's very beneficial at it helping you advance your circadian rhythm so you get in line with where you're going if you're going to the east. If you're going to the west, it's not very beneficial. But I would say this, that your circadian rhythm is very good at becoming delayed. And so usually people don't have a lot of problems with jet lag when they're going west.
Right. So if people decide they need a near-infrared lamp to get that benefit because they can't get outdoors enough, how would they know if it's intense enough for the dosing?
Yes, I am, I'd have to look back at the numbers. I'm not a light engineer, but what you want to do is basically look at the amount of irradiance that you're getting from the sun and seeing how much irradiance you're also getting from this light. Now, it can be complicated because remember that when you're looking at irradiance from the sun, it's at multiple different wavelengths, whereas a lamp is going to be just one of those wavelengths. So you might be getting similar or even more energy at a specific wavelength, but remember that the distribution from the sun is a similar amount of irradiance, but it's distributed evenly over a multiple wavelengths. So it's hard to sometimes compare apples to oranges in that regard. What I would do is if you go on the internet, or if you go to what we have, Amazon, I guess. I don't know. Do you have Amazon there in Australia? I imagine you do. Yes. You can sometimes do a product comparison, and you can see the different irradiance and kind of get an idea about how powerful these lamps are. Some people would ask about infrared saunas, which have become popular. You can put them in your homes. We have a lot of data from traditional saunas like they would use in Finland. where they are generally using heat and actually humidified heat. We don't have a lot of data in terms of mortality, in terms of cardiovascular exercise for infrared saunas as yet. And that's just because they haven't been around as long and the studies have not been done. But I imagine we'll be getting more and more studies as time goes on.
Very good. So obviously there can be side effects from sunbathing, being sunburned, and being an Australian, we've been taught this from from a very early age to always be sun safe. So we know that it's important to avoid sunburn because it's pro-inflammatory. Can you sort of suggest ways that this can be done and still get the benefits of being outdoors?
Absolutely, yeah. So this is important to understand. Remember what we talked about, the damaging rays of the sun typically are in the ultraviolet area. And so those are going to be coming through, generally speaking, between the hours of 10 o'clock in the morning and 2 o'clock in the afternoon, when the sun is the most overhead. And remember, that ultraviolet radiation doesn't penetrate very well through regular clothes. Maybe thin clothes it might. But near infrared does penetrate through clothes very well. And so feel free, if you want your benefit of near infrared lights and you're going outside, put a broad rim hat on, cover up, wear long sleeves. If you want to wear a sunscreen, even if you will, none of those things are going to prevent the ability of near infrared to get into your body and to penetrate through. Okay, so that's one thing. The other thing to do is to avoid, when the sun is overhead, and going outside when the sun is coming up and when the sun is going down. I'll tell you, it's a very, very good practice to get up in the morning when the sun is just rising and get that experience of that sunlight. It does a number of things. First of all, it gives you that bright light exposure, but it also anchors your circadian rhythm so that you don't feel sleep, or you don't feel like you can't sleep at night. Let me explain that a little bit more. If you go to bed later and later and your eyes are exposed to light, not only does it prevent you from going to sleep that night, but subsequent nights, what happens is your circadian rhythm starts to become delayed. So it's you go to sleep and you feel tired later and later and later. And so one of the ways of preventing that from happening is to expose your eyes to bright light in the morning that anchors your circadian rhythm, and so it doesn't start to drift and become delayed. The other thing that it does is it causes your cortisol levels in the morning to spike higher, which allows you to fall asleep better at night. So if you're one that has difficulty falling asleep at night, or you have insomnia, one of the things that I would highly recommend doing is, number one, expose your eyes to bright light in the morning when the sun is coming up. And number two, don't eat 3 hours before you lie down. Making sure that your stomach is empty is going to cause your body to go into that sleep mode much better and not have issues. Charles Dickens knew this a long time ago when he wrote A Christmas Carol. We're actually coming up to that here shortly here. A Christmas Carol, if you remember that Ebenezer Scrooge thought that his hallucination of Marley was a piece of undigested meat or something like that in his stomach, if I remember correctly. So we know that when you have food in your stomach when you're going to bed, that is not a recipe for a good night's sleep.
Aha, very good. Very important tips.
Yes.
So I've had a number of questions from people who have arthrofibrosis, specifically around the use of near-infrared lamps. So I'll read those out. To benefit from light as a knee arthrofibrosis patient, is it more beneficial to have it directly on the knee, or is overall exposure better due to a larger skin area to take in the light?
That's a great question, and it may seem like an obvious answer that you should have the light in the area of the body where it's happening, but it's not as clear as we think, because if you recall, this light that was done on these patients with the glucose, this is light that was done on their back, okay, and yet it had a systemic effect. So we are thinking that the beneficial effects of near-infrared radiation may be systemic and not just in the area where the light is going. And let me tell you something that may blow your mind here, because it blew mine when I understood it, is that we are now starting to understand, there's been papers that have been published that have actually demonstrated this, is that we are seeing whole mitochondria in circulating around in the blood outside of cells.
Okay.
Think about that, okay? So mitochondria we thought were basically intracellular organelles only, but we're now starting to discover that these mitochondria are able to circulate in the blood outside of the environment of the intracellular environment. And so what does that mean? That means that if you're shining light in one part of the body, there are mitochondria that are going by there that are becoming activated. And as they go by, they are now spreading around the entire body, providing energy and those sorts of things to multiple areas. When I first heard this, it sounded incredible to me. But in fact, this is exactly what the studies and what the data is now showing.
Wow, that's quite extraordinary. It has a lot of big implications, I think.
It does. It actually does have a lot of implications.
Wow. Okay. So the next question is, looking to purchase a near-infrared unit. I can only find ones that go up to 850 nanometers, and the near-infrared spectrum goes beyond this. Is this adequate? Here is an example, LED peak wavelengths, and there's 4 different wavelengths that are equal in their power, 630, 660, 830, and 850. And then there's another one, 590 to 700 nanometers and 780 to 900 nanometers. So amongst all this confusion, how do people kind of choose the right one?
We don't know. I mean, it's difficult to say. Are these effects that we're seeing specific on a particular wavelengths, or are they not? And I'll tell you, when I'm talking to people like Scott Zimmerman, who is a light engineer, he's constantly telling me, we don't know. We don't know why this is working, or how this is working, or how this is affecting the human body, or the lack of one wavelength versus the presence of another. We just don't know. It's so complex that we really don't have any guidance as to tell you which wavelength is going to work. And again, this is the reason why I go back to getting out into the sun, because you're never going to be deficient in that kind of an environment. You're getting everything.
For sure. Yep.
Yeah.
Yeah, I personally like bit of outdoor snorkeling in the ocean in the summer. It's very nice. So get all the benefits.
Now the water is very good at blocking that near infrared, so you're not going to get much water, not going to get much infrared under the water. But yes.
But luckily I'm on the top, so
good, very good.
There's questions about lamps with a red light spectrum, and is there any advantage or disadvantage to using this feature as well in the same session?
No disadvantage. As we talked about, there was that one study that, and you know, some people actually consider 670 as part of the near infrared, even though you can see it. But red light, so you can actually see this light, it's visible, 670 nanometers. It's definitely beneficial in terms of reducing blood sugar during a glucose tolerance test. So I don't see any kind of deficiency or detriment. In fact, the more light you have, I think the better. There's even been some misperception about blue light and how bad blue light is. Blue light's bad at night when you're trying to avoid all light anyway. But in the morning time, when you're getting up and you want to go outside and greet the sun, blue light is exactly the type of light that you need to get that stimulation. So I would not wear blue blockers. I would not avoid blue light in the morning time. That's when you want to get as much light as possible.
Very good. So the next question, do I need to use eye protection if I'm able to see the light? I know some of these things are pretty strong.
Yeah, I would never look directly at the sun. That's something you want to avoid. You could burn the retina. We just recently had an eclipse here in the United States, and everyone was getting. I was making for my kids the little pinhole cameras to show where the eclipse was occurring. And of course, we told them never ever look directly at the sun. It'll burn the fovea at the back of your eyes. So when you're using glasses, you're limiting the benefits of the sun. Let me give you an example. So we're talking millions, almost a million-fold different luminal intensity the difference between what our eyes can do. So think about this. When you're in a room with a few lights on, we're talking about maybe 30 to 40 lux. That's how much light, absolute light intensity is in a regular room. Now you go outside and it's full light, full daylight, sun is high up bright in the sky. That's over 100,000 lux. To your eyes, because your pupil is able to constrict when you're outside and then widely dilate inside, the amount of light that you're actually letting into your eye is highly regulated. And so to you, you don't see that big of a difference between the light inside and the light outside. But let me tell you, it's many, many, many fold higher. And that is important because that's the kind of light that you need to make the changes in your brain that you need for benefit. And so if you're going to go outside and get those benefits, putting sunglasses on is only going to diminish those benefits. So again, number one, don't look at the light directly. Get outside, get into the sun. That light will make its way into your eyes by bouncing off things either from trees or from buildings or whatever. And so that's what I'd recommend. So I would avoid using glasses if that's where you want to go. Now, if you've gotten enough sunlight and you're just walking down the street and you want to wear glasses that block ultraviolet light, that's no problem. But this understanding or this kind of indoctrination, like you were kind of mentioning before, that light is dangerous, sunlight is damaging. There was a study that was done a number of years ago called the Southern Sweden Study, and this is a SSS study. I don't know if you're familiar with this. It followed, I think, 20 to 30,000 Swedish women, and they basically looked at mortality, and they looked at diseases, and they looked at their behaviors, and they broke them down into three groups, or basically two groups. There was those Swedish women that had sun behavior that was, not sun avoiding, but actually sun attractive behavior, and those that were sun avoiding behavior. And there was a very distinct difference in mortality. Those that had sun avoiding behavior had higher mortality rates than those that did not. And so it's very clear. These are women at high latitudes that were very fair skinned. And so it was very easy to see in that kind of a group. Now, even those that had melanoma, even those that got melanoma, okay, so we think of melanoma from sun exposure. One of the risk factors for a improved survival, so not a risk factor, but a beneficial factor. So people with melanoma, who were those that had better survival rates? It's those people that were outside in the sun more often. It's those that actually had what they call elastosis, which is another term for sun damage. So people with more sun damage, more time outside, and they had melanoma, had better survival than those that had melanoma and not sun exposure, sun elastosis, and sun avoiding behavior. Very interesting.
That's very interesting and very relevant for Australians, I have to say. Yeah, that's something that's
look that up. Look up the Southern Sweden study specifically on sun exposure. A lot of S's there in that sentence.
Yeah, I think that news needs to get out there a bit more.
Yeah.
So in terms of eye protection, I guess if you're using a red lamp that's very, very bright, there could be a bit of damage from that to your eyes. So a lot of these devices come with dark glasses. You'd probably recommend using the glasses for those.
Yeah. Especially if people have eye problems that, obviously listen to your eye doctor, because if you have a very specific problem with your eye, you need to follow what your eye doctor is telling you. My advice is generally for the population, but if there are specifics, macular degeneration, glaucoma, cataracts, these sorts of things, then you need to listen to your eye doctor and do what they say.
So another question, is there no ideal length of time or frequency or number of sessions for different situations, like immediately post-operative or maintenance level? Can we overdo it?
Yeah, I don't think we can overdo it. People used to spend all day out in the sun, so they used to get a lot of infrared light. I'm not sure if we can overdo it, although with the machines that we have today, which are pretty powerful, it may be possible. So I would stick with the manufacturer. Again, all of these machines are so diverse and they have so many different recommendations that I would follow, ideally, a protocol that has been actually studied. If it's possible. If it's not, then follow the manufacturer's recommendations.
And you mentioned there's a lot of these devices on Amazon. One of the questions was there is a bewildering array of light therapy devices that we can buy. Do you think a lot of these are a scam, or do you think they're actually useful?
They could be. Especially they could be a scam. And so that's why it's important. I think it's really important that if you want to be assured that you're getting the benefits, that you should buy a machine or a device that has been previously tested and published. There are those machines that have done it. They've gone through the work of doing it. And obviously those machines are going to be more expensive. Sometimes in the literature, they will tell you that they built a device, and they'll tell you how they built the device and what type of lights or LEDs that they used. For instance, there was that jacket that I was referring to. Those LED bulbs are basically bulbs that you could buy from any kind of supply store. It's the same kind of LED light that is used in remote controls. Okay, so the LED at the tip of your remote control is an infrared light, and these are the types of LEDs that they actually used in that study. So so long as they give you the specifications and they tell you how they did it and the intensity, and you're able to reproduce that, that's what I would stick with. Otherwise, we just don't know.
Look for the research.
Yeah.
Yeah. So thank you so much, Dr. Seheult. It's been an incredible discussion. You've explained this whole topic of light as medicine extremely clearly, which is your speciality, explaining things clearly. So I guess we should also be clear that these near-infrared therapy devices, or even being outdoors, isn't a magic wand that we can wave and we're just going to get better. We have to have realistic expectations, and we're probably not going to feel an immediate benefit from a session. But over time, these effects are cumulative, and we can hopefully direct our healing response in a better direction than it might have otherwise been. So to sum up, and please do tell me if I have got anything wrong here, being outdoors in particular, and if we can't do that enough, near-infrared radiation therapy has a lot of different benefits for our health, number of different ways, but the overall effect is to reduce inflammation and fibrosis. And it's going to be beneficial for everybody, not just people with arthrofibrosis. So the more we can do it, the better, really. And
Absolutely.
obviously, arthrofibrosis.
I was going to say absolutely. So we need to make sure that it's taken in conjunction with a bunch of other therapies like nutrition. There's very good data in science that eating a very good diet, high in berries, which has a lot of polyphenols and antioxidants, can also be very beneficial in arthritis as well. And so if you're doing a lot of different things that all lead to the same, then you're approaching it from different aspects, and that's really the best way to do it.
So they're a lot of different topics that I would love to discuss with you maybe sometime in the future, to cover those sorts of aspects of how we can help our immune system and help us get over these terrible diseases that we have. Hopefully head them off before they become chronic diseases in the early post-operative period or whatever. Yeah, post-injury.
Exactly.
Yeah, and though there's a lot of different structures in knees and other joints that are different to organs, for example, the fibrotic processes, the pathology is kind of the same for all of them. So we might have other things going on, like a swollen Hoffer's fat pad, IFP, that can get pinched in the joints and cause inflammation. But overall, what will help with treating fibrosis and inflammation will also help people with arthrofibrosis. Would you agree with that?
Yeah, I think there's a lot of overlap.
Very good. So I very much appreciate your time, and also the more than 500 YouTube videos that you've put out there for the general public. It's quite an incredible service that you provide for us. And MedCram is a wonderful YouTube channel, and I highly recommend it to anyone who wants to know more about general health. Thank you so much.
Well, thank you, Haley. It was a pleasure.
Thank you.